Bismillahirrahmanirrahim. Today we are going to perform the another practical, that's Rumen Fistulation. Before we may have to start, the first slide is showing my introduction, and you can watch this lecture again on Team and as well as on my channel, and that's on YouTube. Or you may have to communicate with me any problem which you may have to face during this online lecture. You can communicate through an email, journal email, that's kashiwal2003@gmail.com, or you can contact with me on my official email address, that's abikashiwal@sauedu.com. You may have to send any message or even to make a communication on my WhatsApp number, that's 0300 305 466. So we are proceeding towards the Rumen Fistulation. Actually, Rumen Fistulation is one of the surgical procedure by which we have to make a fistula and apply the cannula in the rumen. So that has to need the ruminostomy, that's Rumen Fistulation. Ruminotomy is the fixation of a cannula or a fistula in the rumen is known as ruminotomy. So this is a common practice that whenever you have to perform any observation on the digestion of the rumen, that how it is being digested during chewing and then after regurgitation. So you can take a samples for 8 hours eating and 8 hours regurgitation and 8 hours resting. So you can take the samples to analyze that one, that how human can be analyzed by observing and taking the samples from a rumen. So ruminotomy is a surgical procedure which involves an incision into the rumen, which is subsequently closed by the end of the procedure. So you have to open the rumen, means you have to perform a laparotomy through a flank incision, that's the right flank is being chosen, so that the rumen is very reachable and accessible from left side. And this is common that if you want to apply any cannula or any fistula, you have to in the hollow of a left flank you have to puncture. So in this procedure we perform an incision from a vertebral column towards the abdominal region. So that's oblique incision is being performed from the skin, and then the external oblique muscle, internal oblique muscle, and transverse muscles are being separated, and the peritoneum is snuffed out, and then the stomach rumen is isolated, and then the cannula or fistula is fixed in the rumen, and then it has to be sutured, closed, so that the rumen fistula may be used for sampling and further experimentation. So fistulation and cannulation of the rumen are integral part of the bovine and small ruminants, caprine and ovine. Nutritional studies recommended as a conservative treatment in cases of a chronic blood. If there is a chronic blood, to evaluate that one, that how to see that one, observe that one. Even the chronic blood cannot be occur whenever you are applying a fistula or a cannula. So this is one of the treatment as well for chronic blood. And frequently, if there is any blooding or a tympani is being arising in ruminants, it can be resolved by applying a cannula. So this cannula is mostly there is a different sizes of the cannula available for the sheep, cow, goat, and buffalo. So we are using a different sizes of the cannula for fixation in the rumen, and then the nutritional analysis can be performed. So the for this operation you needed 3 pieces of the umbilical tap, that's 1 by 4 or 3 by 8 inch and 18 inches long, and chlorhexidine skin cleanser. This is the one of the antiseptic which is applied in a 4% to anticipate the skin, or even 70% isopropyl alcohol is used to clean up the bacterial contamination, or even the area is being anticipated by the isopropyl alcohol. So alcohol 70% is used for cleaning the skin area. Whereas the number 3 Vetafil, the similar non-absorbable suture is required for suturing the skin of the animal, whereas the tincture iodine is also used to paint the area, so that the as you are knowing that the isopropyl alcohol is a transparent in its nature, whereas the pyodine also gives the same function to kill the microbial organisms, but it also paint the area so that you can observe that where you have applied the antiseptic solutions. If there is any area left behind for the application of any antiseptics, that will be very clearly demonstrated by the color of a pyodine. So the color of the pyodine always gives you the clear perception or even a clear vision on an antiseptic area. And then you needed a sterile 30 cc syringe for the local anesthesia, and sterile 20% 20 cc syringes, and you can use the lidocaine for local anesthesia with epinephrine. Mostly the lidocaine is available alone, but the lidocaine with the epinephrine is also available in the market. You can use the lidocaine 2% with epinephrine. Mixed with the epinephrine is a more effective and gives you good results. Habitain cream can be applied, and that is needed whenever you are fixing up the cannula or a fistula. So impervious disposable drap material means you have to perform a dressing of the area, so that you have to apply the drap which has to cover the portion of that which is exposed to the animal. All the animal is covered with the drap, and only the incision area is left behind, so that you can perform surgery on only at the left flank area. So sterile disposable scrubs, brushes are required, so that you have to use it as a preparation of the patient, preparation of the instrument, preparation of the surgery material, and preparation of the surgeon is required before going to perform the surgery. So the Rumen cannulas that must have a stoppers, so 3 inches and a 4 inches cannula can be fixed in the large animal like a buffalo or a cow. The 3 serpentine needles are needed. Sterile disposable spinal needles 18 gauge by 3 by ½ inch. That's the instruments which needed to be autoclaved, sterilized. So the sterile 18 gauge 1 by 1/2 inch needles are required. Then the sterile 18 gauge by 5 inch needles are required. A large tissue thumb forceps having no teeth are required. 6 large towel clamps are required to fix the towel or a drap around the area. large red tooth thumb forceps are required to perform the surgery, and you have to hold the tissues by using the large red tooth thumb forceps, and two triangular cutting needles needed, and then the scalpel handle number 4 with the scalpel blade number 20 or 22. So these can be used to cut down the skin and as well as to cut down the muscles and separate the snip down the peritoneum. Kelly forceps, one straight and one curved is required. That will help you to snip down the area, and the large needle drivers are needed because you have to suture the skin, you have to suture the peritoneum, you have to suture the muscles. So therefore you have to perform the suturing, and the suture scissors, 2 pairs are required, mosquito forceps are required, tissue scissors large are required, 2 Alice tissue forceps are required, surgical clipper with a number 10 blade, because you have clip out in the animals having hairs on the area, like a sheep and goat is possessing the hairs, so it can be removed by using a clipper, whereas the buffalo does not possess enough hairs to be removed, whereas the cows needed to clip down the hairs from the left flank area. These are the instruments which should be autoclaved, and these are instruments are required. So before going to operate the animal for fistulation, you have to arrange the instruments, then the material, and lastly that you needed the hand towels because the material which is required for the preparation of a surgeon, you have the gowns for a surgeon and assistant, whereas the drap disposable for a cow 5 feet long width with a roll. So the surgical mask and the cap is required for a surgeon. Then the gloves, hand gloves are required to be weared, and drap disposable for a shoot boss, whereas the drap which has to cover the area. So for a fistulation, you have to perform the draping of the area. So this is the one of the requirements, that you needed the material, then you needed the instruments, and then you have to use the gowns, draps, and surgical mask and cap gloves for the surgical procedure. So this is the material required for the preparation of the surgeon and preparation of the patient and preparation of the assistant or team. So the indications why we are doing the ruminotomy. So for this purpose, you have to see that the Riemann surgery may be indicated in sheep, goat, and cattle for the following reasons. Traumatic reticuloperitonitis, hardware diseases, especially the animals may have to engulf the nails or the material, stainless steel material, needles like structures. They needed this surgical Riemann surgery. Removal of foreign bodies, mostly the plastic material or undigestible material, can be removed by the ruminotomy. Severe blood, if there is no solution for a blood, if you are failed to treat the blood by chemotherapy, then you have to perform ruminotomy for the chronic or severe blood. Vagal indigestion, the vagal indigestion which has to be created in the animals, that can be treated by ruminotomy. Carbohydrate overload, if there is a problem with the carbohydrate overload, that can be also treated by ruminotomy. Evacuation of a rumen following the ingestion of toxins or poisons, mostly the animals may have to engulf or ingested the toxins or poisons, that can be removed by a ruminotomy. Rumen infection can be treated by a ruminotomy. Infection, atony of a abomasum or a omasum that can be treated by the ruminotomy, and rumen fluid collection for a transient procedure, so that can be done by ruminotomy. So indicated if no specific diagnosis has been made, but the clinical picture appears to indicate involvement of the stomachs, like heart area, that is 100 beats per minute. If a reduction of a fecal output or a gastrointestinal hypomotility, abdominal distension, abdominal pain, and experimental procedure that needed. This is the one of the indications. So we are doing over here ruminotomy only for experimental procedure, not for the treatment or other indications. So mostly the other indications are being observed or treated whenever that is required for the treatment of the patient. Whereas we are doing this procedure only for application of a fistula or a cannula into the rumen. There are three techniques to perform the rumen fistulation: a one-stage method, two-stage method, and SCHALK and AMADON technique. So the ideal fistula is one that forms a seal around the cannula. Sorry that I have lost my connection. Again, I'm going to restart the slideshow, this lecture, because due to electricity disconnectivity, I was unable to continue, and that's no matter. We will restart this lecture, and this will refresh your knowledge as well. आपने क्या सुना और क्या समझा ये भी असल में क्लियर हो जाएगा, और मैं इसको दोबारा जो है ना रीस्टार्ट करता हूँ, क्योंकि जो प्रीवियस मेरी अपलोडिंग थी लेक्चर की वो रिप्लेस करनी पड़ेगी, तो इस वजह से आई विल टेक a few minutes to reload and then I will start the lecture. ये हम प्रैक्टिकल है जो हम यहाँ पे कराते हैं स्टूडेंट्स को, बोर्ड पे भी कराते हैं, काफ पे भी कराते हैं, तो इस वजह से अभी जो ये है हम इसको एक ऑपरेशन है जो हम यहाँ करते हैं, बोर्ड में करते हैं, शीट में करते हैं, फिर हम कभी कभार हम इसको जो है रैबिट पे भी करवाते हैं, तो फॉर एक्सपेरिमेंटेशन पर्पज नाउ एज आई हैव read over 7th slide, so I may have to start from a first and then I will go to a 7th one, because it will be the repetition. Those students who have joined recently, जो अभी जिन्होंने ज्वाइन किया है, तो उनके लिए भी ये थोड़ा सा आसान हो जाएगा टू अंडरस्टैंड द थिंग, और फिर मैं इसको जल्दी जो 7 स्लाइड्स तक जल्दी जाऊंगा और फिर इसको कंप्लीट करूंगा. तो Rumen fistulation is a topic or an experiment which we have to perform on a goat or calf or even on a rabbit. So the ruminotomy, the rumen fistulation, the creation of a semi or a permanent fistula between the rumen and the body, is known as a ruminotomy or a rumen fistulation. So the ruminotomy means making a fistula, whereas the ruminotomy is the opening of the rumen. Is a surgical procedure which involves an incision into the rumen, which is subsequently closed by the end of the procedure. So the fistulation and cannulation of the rumen are integral part of the bovine and semi-ruminant, especially the caprine and ovine. Nutritional studies recommended, whereas a conservative treatment in a case of a chronic blood is also used as a ruminotomy is one of the procedures that helps to treat the chronic blood or tympani. Mostly the supplies which are required for this operation is 3 pieces of umbilical tape 1/4 and 3 by 8 inches into 18 inches long, whereas the chlorhexidine skin cleaner is in the 4% is required to clean the skin. 70% of a isopropyl alcohol is required to anticipate the area. Number 3, Vetafil. This is the similar type non-absorbable suture material is required to suture the skin. Iodine solution is required to apply on the skin to tantist as well as to kill the microbial organisms. So we need the sterile 30 cc syringes and as well as a 20 cc syringes or 20 ml syringes. And for the application of or administration of a lidocaine, which may be used in the form of infiltration, and the lidocaine 2% with epinephrine is a more suitable combination of the local anesthesia. So that has to only anesthetize the local area which is going to be operated, and mostly we have to infiltrate this lidocaine in a L shape, so that the invertible L shape is injected the needles at points which we will discuss later on. The impervious disposable drape material is required. Sterile disposable scrub brushes are required. A Rumen cannula with a stoppers that might be a 3 inches or 4 inches in length, they are required to apply in the cow or a buffalo. The instrument packed autoclaved, the 3 serpenile needles are required. Sterile disposable spinal needles are required. Sterile 18 gauge needle is required. Sterile 18 gauge into a 5 inches needles are required. Large tissue thumb forceps, no teeth, means plain thumb forceps is required. 6 large towel clamps are required. Large red tooth thumb forceps is required, which is mostly known as a tooth forceps. The 2 triangular cutting needles are required. Scalpel handle with a handle of a 4 number is required, and mostly in the scalpel handle number 4 has to fix only the 20 number or 22 number blade. So the 22 or 20 number blades must be available for fixing it into the handle number 4, scalpel handle number 4. So forceps are required straight and curved. A large needle driver is required to suture the area. Suture scissors, 2 pairs are required. Mosquito forceps are required. Tissue for scissors, large are required. 2 LS tissue forceps are required. Surgical clipper with a number 10 blade. These are the instruments which must be autoclaved or sterilized, and the pack of the so that has to be sterilized, and these instruments will be used in the surgery. So you have to list these required instrument and required material. Then we have to need the material like the hand towels, the gowns for surgeon and assistants, drape disposable for cow, the 5 feet long and width of a roll, whereas the surgical mask and cap is required for a surgeon and assistant. Gloves, hand gloves, which must be a rubber gloves, they are required for the surgeon and as well as the team. Drape disposable for shoot bars are required, so to cover the animal, and only the area of the incision is left without draping, whereas the whole animal is being covered with a drape, so that no contact of the hands and instruments may take place with the body of the animal during surgery. Why we have to perform this surgical procedure? The human surgery may be indicated in sheep, goat, and cattle or buffalo for the following reasons: traumatic reticuloperitonitis, if any animal has ingested the hardware like stainless steel nails or needles that requires to be removed. The removal of a foreign body like undigestible foreign bodies like plastic ropes, plastic bags, or plastic material. So that can be removed by a ruminotomy. Severe blood, which is not giving a response on a chemotherapy, that can be treated by the ruminotomy. The vagal injection that causing the indigestion due to a vagus nerve, that has to be treated by the ruminotomy. Carbohydrate overload, if the animal is overloaded by the carbohydrate, that can be relieved and that can be treated by a ruminotomy. Evacuation of a rumen following an injection of a toxins or a poisons, you needed to evacuate the rumen by a ruminotomy, or even the rumen infection can be treated by a ruminotomy. Impact or atony of the abomasum and the omasum also can be treated by a ruminotomy, and the rumen fluid collection for a transformation procedure, you have to perform the ruminotomy. So indicated if no specific diagnosis has been made, but the clinical picture appears to indicate involvement of the stomach, like increase of a heart rate up to 100 beats per minute, or reduction in a fecal output, or a gastrointestinal hypomotility, or abdominal distension and distension, or abdominal pain. That these are the indicators that the animal is possessing any abnormality in the stomach. They also be treated by the ruminotomy. So the procedure which we are doing today, that is the experimental procedure. So we are doing it to apply a fistula or a cannula, so that we may have to prepare the animal for nutritional analysis of the feed or a digestion process in the animal. So there are the methods of Rumen fistulations. There are 3 techniques to perform Rumen fistulation: 1-stage method, 2-stage method, and SCHALK and AMADON cannula. The leakage of the Rumen fistula technique is quite successful in sheep, while 2-stage technique is recommended in the cattle. The first is 1-stage technique. The rumen is exteriorized through a circular and vertical skin incision in the left paralumbar fossa, incised and sutured to the skin. The cannula inserted into the ruminal opening at the same day of a surgery. So this is the 1-stage technique which is successful in the goats or in the small animals like a sheep. So whereas in a cattle you have to perform the 2-stage technique. The 2-stage rumen cannulation technique: first, exteriorize a rumen segment within a wooden clamp, fix the clamp to the skin with a 6 matrix sutures. After 1 week, the necrotic rumen segment will be removed, leaving a rumen fistula in which a 7.5 centimeters cannula was inserted. So this will be replaced by a 10 centimeter cannula a further 1 week later. So the surgery will take an average of 30 minutes. At least one assistant is required for the technique. The second is a 2-stage technique. The rumen is exteriorized through a circular or vertical incision in the left paralumbar fossa. The ruminal wall, without opening of the rumen, can be sutured to the skin along the edge of a laparotomy incision to form an adhesion between the rumen and the skin, or a metal clamp is applied to fold the exteriorized ruminal wall through the laparotomy incision, and then allowing a fistula to develop a gradual necrosis and sloughing of the fold and adhesion of the rumen to the skin. So the cannula is inserted 7 to 12 days after a surgery to allow the adhesion formation between the ruminal wall and skin. SCHALK and AMADON technique. The third technique was first described by the SCHALK for the cattle and modified for a sheep by Hecker. A fold of a rumen wall is exteriorized and clamped between 2 metal bars. The fold necrotizes and sloughs. A fistula between the lumen of the rumen and the outside is created. The rumen fistula in sheep is usually performed in a 1-stage method. The 2-stage method is usually recommended for cattle, but other researchers used this method in a sheep as well. So these are the rumen cannula. The ruminal cannulas are made of a plastic, rubber, or even a metal materials that may be placed and fixed properly to prevent leakage. This is one of the requirements. There shouldn't be a leakage whenever you are applying the fistula or cannula in the rumen. So you can see that the ruminal cannula, the custom made ruminal cannula that has a rubber radiator hose length, the rubber radiator hose internal diameter, the rubber inner flange diameter, the rubber inner flange thickness, rubber ridge to retain the metal outer flange, whereas the metal outer retainer flange diameter, and then the stopper. So the stopper is applied to knock the leakage, and then whenever you require to collect the sample, you have to open the stopper and then collect the sample from a rumen. So rumen fistulation and cannulation will be adopted practically for obtaining samples of ruminal ingesta, fluid or gases, and also in situ degradation studies for feed evaluation, research, and ranking of a feed. So this is the fistulation being performed to take a samples of ingesta and then to evaluate it for ranking the feed digestibility and to see that how much time the feed is taking for digestion in the rumen. The animals will be stabilized for the adaptation for 1 week prior to surgery. This is the pre-operative preparation which is required for surgical procedure. Food will be withheld for 24 hours and water for 12 hours in ruminant animals. Mark the skin with an indelible marker using a round template. The same size of the cannula to be used. 1 cc cannula requires 4 inches or 10.2 centimeters diameter fistula. So note, it is preferable that this be done before the paravertebral block is performed and the skin relaxes. So the template should be same diameter as the center diameter of the cannula or slightly smaller. In case of the thin-skinned animals, the vertical diameter can be reduced by 1/4 of an inch or 0.5 centimeters from the lower or ventral edge. This will correct for the stretching of the fistula over time. So this requires that the hole being made smaller than the cannula or fistula. The outer diameter of the cannula and the fistula should be adjusted with the incision being made in the rumen and as well as in the skin. So the procedure to ensure a properly positioned and circular fistula. So clip the paralumbar fossa from the transverse process to the vertebral ventral edge of the flank, fold, and from the 30th rib to the hip bone. So clip the area of the injection plus a radius of 2 inches around with a number 10 blade clipper. Surgically prepare the site of the incision using at least 3 separate scabs with chlorhexidine and finally prepare with the alcohol. Now, if you see that the procedure to ensure the properly positioned and circular fistula, you have to prepare the left flank and remove the hairs and then apply the antiseptic solution like chlorhexidine and alcohol and then the pyodine. The left paralumbar region will be prepared for aseptic surgery. The operation will be carried out in a recumbent position and the operated animals will be positioned on the right side. The animals should be positioned on the right side and the left side should be on the upper side so that the left area may be operated. The area will be prepared and then the mark for the application of the local anesthesia, that's the lidocaine or xylocaine can be used, and then the area we have to perform an incision and make a fistula or a hole in the rumen, so that will be also marked for the incision so that the fistula may be fixed properly. Anesthesia. Operated animals will be injected intramuscularly with a diazepam 0.5% in the dose of 2 mg per kg body weight, and 10 minutes later the animals will be injected with a xylazine at 0.22 mg per kg intramuscularly, and the local anesthesia, that's xylocaine, will be used to infiltrate the surgical site, that's an inverted L block, thereby the blocking the nerve supplying that region. So perform the paravertebral block T13, L1, L2, L3 using 2% lidocaine with epinephrine. So ensure the skin is anesthetized by checking for a sensation with a hypodermic needle at least 15 minutes after the block was performed, so that we have to see that the animal doesn't sense in the skin. Then we have to perform the incision on the left side of the flank region to cut down the skin. So preparation, create a blood line in the skin following the individual marking made. So you have to perform the marking of the skin, so that you have to inject the lidocaine and as well as to perform the incision. This blood line will be used as the guideline when the skin is removed during surgery. This may be accomplished by scoring the skin with the 18-gauge needle, so that the boundaries of the proposed incisions are outlined. Creating the blood line to follow the lateral will significantly improve the final shape of the fistula and will reduce the likelihood of a rumen contents leaking post-operatively. So this procedure will gives you a confirmation that there is no leakage and there will be no post-operatively any passage from the cannula or sides. So therefore, there will be a complete seal after application of the fistula and cannula. So the preparation of the incision site, surgically prepare the paralumbar fossa by utilizing at least 3 scrubs with a Habitin skin cleanser, then perform a final scrub with a chlorhexidine, followed by the alcohol rinse. Paint the incision site and surrounding clipped area with the iodine solution. So this will site. Whereas the preparation of the surgeon, team and patient is required, the surgeon assistant should do a routine pre-operative scrubs and do put on sterile surgical gowns and surgical gloves, place a sterile impervious drape over the horizontal bar on the chute and clamp it to itself under the bar to hold it in a place, and drape the surgical site with a sterile impervious drape, that's a towel clamp to the skin to hold it in place. Cut out a portion of the drape to provide an opening to the incision site. Look at this one. You have to perform the preparation of the site by if you see that a perfectly round skin incision of the same diameter as the center diameter of the cannula or slightly smaller is made in the mid-paralumbar fossa, 4 cm ventral to the transverse process of a lumbar vertebrae, and 2 cm caudal to the last rib by following the blood line. So this is the laparotomy. If you see that the laparotomy in a figure, the skin incision A, and then the exposing the abdominal rear muscles, then give the technique opening of the abdominal muscles bluntly along their fiber direction. So you have to see that the skin is removed, the muscles are removed, the peritoneum is removed, and the rumen is exteriorized. So this area is dropped, as well as the antiseptics are applied, the hairs are clipped, and the incision is made around the marked area, so that the incision must be smaller or a similar size of the fistula. If you see, the incision will be continued. Through the delicate subcutaneous tissue, the external oblique muscle, internal oblique muscle, and then the transverse abdominal muscles will be dissected bluntly along the direction of fibers. So gate technique. This is the dorsal sake of the rumen will be exposed after a sharp incision of the parietal peritoneum. The dorsolateral portion of the sake will be grasped with a pair of Alice forceps and pulled through the abdominal wall incision. So this is the anchoring of the rumen before opening of the rumen to the subcutaneous tissues using the a vectoral size in one size of one number in circumferential continuous pattern. So exteriorization of the Riemann, if you see that one, the upper picture is showing that the Riemann is being exteriorized, and then the application of the vectoral suture material is applied so that the circumference may be obtained, whereas the anchoring of the ruminal wall to the subcutaneous tissue. So this is being exteriorized, and then you have an option that this insertion of the cannula, how you will insert that one, folding the inner flange of the ruminal cannula before insertion into the Riemann. So if you are insert a Riemann by folding it, then it will be easily placed in the Riemann area, inside the area, so that it may be fixed properly. This portion will be anchored to the subcutaneous tissue using a number 1 vector and continuous circumferential sutures passed seromuscularly in the ruminal wall. The exposed portion of the Riemann wall will be incised circularly, gauged strictly enough to allow the rubber radiator holes of the cannula. At the midpoint, the cannula will be thoroughly lubricated with gel to facilitate its advancement into the ruminal stoma smoothly. The rubber inner flange of the cannula will be folded and pushed through the radiator holes from inside to outside. So this is the way by which you are inserting the cannula inside the Riemann. So it should have to be lubricated, so it may have to pass through the incision site. The surgery place the stitch sutures of a umbilical tape through the wall of the exposed Riemann by using the serpentine needle. Insert one loop of a umbilical tape of the exposed Riemann tissue, leaving a large enough loop to use as a handhold. So an assistant exercises a portion of the Riemann by applying outward the traction to the umbilical tap loop. So that once the Riemann has been penetrated, the surgical site, instruments, and the surgeon are no longer sterile, although appropriate aseptic techniques should continue to be followed. Surgery with the Riemann exteriorization make a 2 or a 3-inch incision through the Riemann wall and into the interior. So this may be enlarged as needed to allow the complete suturing, ensure the Riemann incision is adequate to prevent the excessive stretching of the Riemann and or a punching of the skin at the fistula edge. Suture the cut edges of the Riemann wall to be cut edge of the skin utilization and continuous pattern with a 3-number beta-fill sutures, the 1/4 of the circumference at a time before tying off and starting the next suture pattern. So 3 to 4 continuous sutures should be used rather than a 1, so that if the suture breaks, the entire suture line does not come undone. So suturing should begin at the bottom of the incision and progress up both sides, with the top being closed last to reduce the likelihood of a Riemann and contents being introduced into the peritoneal cavity. Rinsing of the exposed muscles and skin with the sterile saline or lactated ringer solutions may be performed as needed to keep the body wall clean. Care must be taken to not allow the contaminated fluid to enter the peritoneal cavity. A small quantity, 5 to 10 ml of the long-acting penicillin, should be sprayed directly on the muscle layer as it is closed to prevent infection. Clean the incision area with the water and habitain to remove debris. Insert the model 4C 3 inches Riemann cannula to prepare cannula for insertion into the animal. Remove the stopper from the cannula, reach through the center of the cannula and graft the inner flange of the cannula and pull it back through the center of the cannula until approximately half of third of the inner flange is on the outside side of the cannula. This will leave the half of the inner flange folded from a small enough to clear the fistula. So the placement of the cannula is in hot water enables easier inversion of the inner flange of the cannula and folding of the cannula for insertion. So this is a very easy. If you have to put this cannula into hot water, then this plastic material will be easier to fold and insert into the incision area. So we have to the flange has to be inserted into the incision site, so that it must have to cross the rumen incision, and then it may be fixed with the suturing. So to place the cannula insertion and removal, to place the folded cannula in the animal, insert the folded inner flange through the fistula and push the remaining inner flange back through the cannula center, returning the inner flange into a position inside the rumen. Then place the stopper in the cannula. Mineral oil can be applied to the stopper or center of the cannula to make future removal of the stopper easier. So the cannula is removed from the animal by first removing the stopper. A small dull screwdriver, not too long, can be used to assist the stopper removal, and mineral oil is good lubricant for stoppers. Following removal of the stopper, reach through the center of the cannula and graft the inner flange of the cannula and pull it back through the center of the cannula until approximately half of the inner flange is on the outside of the cannula. Then remove the cannula from the animal. The cannula fixation. And now if you see that in this picture, the cannula has been fixed in the at the area of the rumen. It has crossed the rumen. It has to be fixed outside of the skin, and then you can see the stopper is observed outside of the area. So the folded cannula inserted manually into the encode rumen. It will be carefully unfolded by pushing the folded inner flange by close to the abdominal wall. The ruminal stoma will be then sutured to the skin using a #1 Vicryl in a continuous circumferential pattern with a 2 runs 12 to 6 and 6 to 12 o'clock. So this is the cannula where you have to see that the cannula insertion into the rumen, suturing the ruminal wall to the skin in a circle. So after that, the stainless steel sealing disc metal retainer flange will be pushed out over the neck of for radiator. The hose in its socket to insert the a rubber stopper used to close the cannula. So pushing the metal retainer flange over a neck of the radiator hose and its socket to ensure the stability of the cannula. So this is the circuit which is being applied, stainless steel circuit. So it will not allow the cannula to push back or go inside the. Whereas the post-operative Post-surgical medical treatment included the use of systematic antibiotics like a penbiotic 1 ml per 20 kg body weight twice daily, or anti-inflammatory or analgesic drugs like a vitofonic 1 ml by 45 kg body weight for 3 to 5 successive post-operative days. Whereas antibiotics immediately post-surgery, an antibiotic should be administered like cetiofor at a dose of 1 mg per kg, or axinel 1 ml per 50 kg intramuscularly, or axinal RQ 1 ml per 50 kg subcutaneously. These are the antibiotics which can be applied to stop the infection or to prevent the infection, because this is aseptic surgery, but when you are operating a Rumen, then definitely the area is contaminated, and this will needed the antibiotic cover, so you can apply the any antibiotics, and for 1 or 2 days only the analgesic and anti-inflammatory drugs are required. Otherwise, the only antibiotics for 3 days required. So immediately post-surgery, an analgesia should be administered, benamine at 1 mg per kg intravenously, enophane, ketoprotein at 3 mg per kg, or 1.45 bleeding, irritation, trimming and removal. The area should be inspected for the presence of fissures. Habitant cream can be applied to a surgical site, and the cannula when it is replaced. So remove the sutures 14 days following the surgery. At this point, the 4-inch cannula, the model 1C, 2C, 3C, 9C, should be placed in the fistula site unless the number of the deep fissures are present. If they are present, the three following the placement of the 4-inch cannula, tissue along the edge of the cannula will start to die due to pressure. This is normal. It is recommended that the 7 days following the 4-inch cannula placement, that the surgery site be cleaned and any necrotic tissue trimmed and removed. The cannulation site should be inspected every 7 days until the cannula site has been healed. Body weight of each animal will be obtained weekly for 6 months. The cannula stopper and the wound will be checked daily to confirm stability of the cannula and its placement without leakage. So you can see the fistula and the goat. This experiment was carried out in the Department of Surgery, where we have placed the Rumen fistula, and then the nutritional analysis was performed on the goats. Is completely performed, and there is no any complications after the application of this cannula. So this always gives you a better result if there is no complications or there is no any infection or any pathological or damage or injury. So that may have to heal quickly. So this is the fistulation. If you see the fistulation in the sheep, fistulation in a cow, fistulation if you see that in a cow. So the complications which may arise, that the abdominal wall incision and stabilization of a ruminal cannula in the rumen fistula are a big challenge to the surgeon, especially in sheep, due to weak abdominal wall musculature. The main post-operative complication is the leakage of the ruminal fluid between the surgical wound edges due to a scarring, necrosis of the tissues, the damage of the low quality material used as a rubber cannulas, or when using a cannula or of a rigid material as surgical incision must be bigger in size to let the cannula pass in it. Moreover, infection and peritonitis are the most common post-operative complications, and that possibly tend to severe crisis to death. Thank you very much. This is the last slide which I am showing you for observing this lecture and this practical again on by using the team as well as my YouTube channel, so that you can see again this video. Thank you very much. If anybody hasn't received a complete voice, he may have to re-listen this lecture. Thank you very much. I will allow